तो आज हम इस बुक को देखेंगे जिसका बुक का नाम है मेडिकल सर्जिकल नर्सिंग, जो कि इसका एडिशन है साउथ इंडियन एडिशन। और इसके ऐसे ही एडिटर हैं सुरेश के शर्मा एंड एस माधवी। एंड हाईलाइट किस पे किया गया है, द हाईलाइटिंग ऑन दिस बुक इज द कंप्लीट कवरेज ऑफ कंटेंट एज पर द इंडियन नर्सिंग काउंसिलिंग INC syllabus, new chapter and relevant content from the Indian South Asian perspective. Indian Counseling of Asian Epidermal is disease and the sequential arrangements of chapter as the MSN first and the second circulum. This book is given by the Bruno and Siddharth. Let's talk about the volume 2 syllabus. First chapter is kidney and urinary tract function. In the kidney and urinary tract function, we have discussed about assessment and kidney and urinary function, management of patient with kidney disorder, and the second one is third reproductive function. In the male reproductive function, the assessment and management of patient with a male reproductive disorder, and next one is integumentary function. In the integumentary function is assessment of integumentary function, management of patient with dermatologist and disorder, and next one is musculoskeletal function. In the musculoskeletal function, we have discussed about the assessment and musculoskeletal function and the musculoskeletal care and modalities, and then management of patient with musculoskeletal disorder, management of patient with musculoskeletal trauma. And next is immunologic function. In the immunologic function is assessment of immune function, is management of patient with immune deficiency disorder, and assessment of management patient with the allergic disorder, assessment and management with the patient with a rheumatic disorder, communicable and the infection disease, is management of patient with a communicable and infectious disease. And next is sensory function. In the sensory function, we have discussed about the assessment and management of the patient with a nose and throat disorder, assessment and management of the patient with a hearing and the balance disorder, assessment and management of the patient with the eye and vision disorder. And next is the neurological function, is assessment of neurological function, assessment of patient with the neurologic dysfunction, management of the patient with the cerebral disorder, management of patient with the neurologic trauma, management of the patient with neurologic infection, autoimmune disorder and the neuropathies, management of the patient with the oncologic or the degenerative neurological disorder. And the next is female reproductive function,